1. Chest pain or discomfort. Chest pain is the most common heart attack symptom, but some women may experience it differently than men. It may feel like a squeezing or fullness, and the pain can be anywhere in the chest, not just on the left side. 2. Shortness of breath. Dysapnea, or breathlessness, is a strong feeling of being unable to draw a deep breath. It often occurs among both men and women for up to 6 months prior to having a heart attack. It is usually a warning sign of a medical condition. 3. Irregular heartbeat. Skip beats or arrhythmias are often accompanied by a panic attack and anxiety, especially among women. It appears unexpectedly and reveals itself differently. Arrhythmia, irregular heartbeat, or tachycardia, increased heart rate. Physical exercises might give an extra stimulus to the increase of heart rate, especially in cases with atherosclerosis disease. 4. Jaw pain, toothache, headache. The pain of a heart attack can spread down both arms to the jaw or head or to the back. Some people report tooth pain or headache as a symptom of a heart attack. It is possible to have these types of pain without chest pain during a heart attack. 5. Excessive perspiration. Unusual or excessive sweating is an early warning sign of a heart attack. It might occur at any time of the day or night. This symptom affects women more often and is usually confused with hot flashes or night sweats, typical of menopause. 6. Heartburn or indigestion. As mentioned above, some people experiencing a heart attack can have belching and burping and describe a feeling of indigestion. Likewise, the pain and pressure of a heart attack may occur in the epigastric or upper middle abdomen area, similar to the pain of heartburn. 7. Insomnia. Insomnia is also associated with an increased risk of heart attack or stroke, which is more common among women. Insomnia features often include a high level of anxiety and absent-mindedness. 8. No symptoms. Approximately 1/4 of all heart attacks are silent, without chest pain or new symptoms, and silent heart attacks are especially common among patients with diabetes. Too often, patients attribute heart attack symptoms to anxiety, indigestion, fatigue, or stress, and consequently delay seeking prompt medical attention. One cannot overemphasize the importance of seeking prompt medical attention in the presence of symptoms that suggest a heart attack. Early diagnosis and treatment saves lives, and delays in reaching medical assistance can be fatal. A delay in treatment can lead to permanently reduced function of the heart due to more extensive damage to the heart muscle. Death may also recur as a result of sudden onset of arrhythmias, such as ventricular fibrillation.